Hello and welcome to the Pediatric Brain Tumor Foundation's webinar, When Trauma and Grief Intersect, EMDR Strategies for Bereaved Families. My name is Alex Henderson, and I'm the Bilingual Family Support Manager for the Pediatric Brain Tumor Foundation. Thank you for joining us today for this important subject. Before we get started, I have a few guidelines to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. Please type your questions into the Q&A feature found at the bottom of the Zoom window. We will not get to every question, but we'll try to answer as many as possible. And we are pleased to welcome licensed clinical counselor Olivia Lynch for today's webinar. Olivia Lynch is an EMDR trainer, EMDRIA Approved Consultant, and National Director of EMDR Services at Newport Healthcare. She developed an in-house EMDR training and consultation program overseeing 200 plus therapists. As an adjunct faculty member with the Institute for Creative Mindfulness, she trains clinicians nationwide. Olivia has a deep passion for healing and personal growth. She believes that we are all human and we all have wounds, some deeper than others. Olivia is passionate about utilizing EMDR beyond trauma, integrating it into diverse clinical settings to support healing, resilience, and growth. So it gives me great pleasure to introduce Olivia.
Hello, everyone, and thank you for having me, Alex. So I will jump right in to talking about looking through an EMDR lens when dealing with grief. Whenever I start talking about EMDR therapy, the first thing I like to go over is just very briefly on trauma, because EMDR therapy was initially developed to treat PTSD. And it's not only for trauma, however, it is incredibly effective and helpful for trauma. So, how do we conceptualize trauma? Trauma is really a wound. And so I like to conceptualize trauma as a wound. And I believe that we all have wounds. Some are deeper than others. And we have to look at, with that, how do we treat a wound? And that also varies depending on how deep the wound is and what that wound looks like. Sometimes our bodies and brains naturally heal, and sometimes they don't. Sometimes they need some more care. And EMDR kind of helps that natural process along. So, in dealing with grief, I guess the first thing I'll say is it's not always easy. And in fact, it's really hard. And coming up with this presentation, I was thinking about how I really want to give you all something that you can utilize and something that makes sense, and also be transparent. So I don't want this to seem like it's magic. It's not. However, I do believe EMDR is incredibly effective. However, we also want to have realistic expectations about what EMDR can and can't help with. And I'll kind of keep that in mind as we go through. We wouldn't want to simply go after the grief, because grief is a normal part of the healing process. However, there's a lot of other things that come along with grief, like thinking about the emotional impacts of grief. Some of the common emotions that I often hear about coming up with grief are sadness, anger, guilt, confusion, fear, and numbness. A lot of you have probably heard of Elizabeth Kubler-Ross, and she says the 5 stages: denial, anger, bargaining, depression, and acceptance are a part of the framework that makes up our learning to live with the one we lost. They are tools to help us frame and identify what we may be feeling, but they are not stops on some linear timeline in grief. And I mention that because with EMDR therapy, one of the things that we really focus on is themes. And each of these could come up in their own way and kind of be a theme, like having difficulty with anger, um, or acceptance. Each of these could be a theme in and of itself, or they could all kind of be coming up jumbled or together at different times. So, what is EMDR? First of all, what EMDR stands for, which is a mouthful, is eye movement desensitization reprocessing. I know that's a lot, and hopefully it'll make a little bit more sense as I go through this. But the World Health Organization definition is this: EMDR therapy is based on the idea that negative thoughts, feelings, and behaviors are the result of unprocessed memories. The treatment involves standardized procedures that include focusing simultaneously on A, spontaneous associations of traumatic images, thoughts, emotions, and bodily sensations, and B, bilateral stimulation that is most commonly in the form of repeated eye movement. So a lot of people think of this when they think of EMDR. Like CBT with a trauma focus, EMDR aims to reduce subjective distress and strengthen adaptive beliefs related to the traumatic event. Unlike CBT with a trauma focus, EMDR does not involve a detailed description of the event, direct challenging of beliefs, extended exposure, or homework. So, one of the most common questions I get is, who's appropriate for EMDR therapy? And I'm probably a little biased because I believe in EMDR so much, but my response is anyone who has a negative belief about themselves, and I haven't met anyone that doesn't. So basically, I think EMDR is really appropriate for most people. However, looking a little bit more into grief and when EMDR might be helpful for grief, again, I'm thinking probably the majority of the time. However, some of the things to consider, and I know one of the questions that had come up that someone had asked was, like, when is it too much? Like, when is the grief too much and do I need more? And so sometimes you're focusing so much on a certain event, which could include the loved one suffering or death, or if you're having intrusive images or thoughts, nightmares, present triggers. I know someone else brought that up as well. Certain things that happen that trigger you every day or very often. If there's a lot of guilt, issues of personal responsibility, or previous unresolved losses, and negative cognition. So, with negative cognitions, that's a big part of EMDR therapy. And I'll go through more about EMDR therapy, but some of you may be able to relate to one or multiple of these negative cognitions. These are some of the most common negative cognitions that I've seen come up with grief. I should have done something. I am to blame. I should have known better. My best is not good enough. I cannot show my emotions. I am not in control. I cannot handle it. I cannot let it out. I am helpless. I am permanently damaged. I am trapped. Okay, so these negative cognitions are kind of the root of what we're focusing on in EMDR. And the goal is to get the distress down and then to shift to a more helpful belief. Okay, and I know this is hard because I know that it's not going to turn into rainbows and sunshine. However, what can it turn into? So these are some possible ideas of what we may be able to shift that belief to. I did the best I could. I can show my emotions. I can help myself. I can handle it. I can find ways to honor their life. I am surrounded by support. I am not to blame. I can be a support to others in need. I can find other ways to stay connected with my loved one. Another one I just thought of would be something along the lines of, I deserve to live a good life, or I deserve to experience good things. Sometimes with grief, we may feel like we don't deserve good things. And we want to get to a place of we do deserve good things. We do deserve to have a positive experience, to have positive emotions. And just briefly going over a little tiny bit of the neuroscience of EMDR. And this is just kind of a little snippet, but we often talk about the triune brain model, which is comprised of three different brains: the reptilian brain, the limbic system, and the neocortex. And EMDR is considered a bottom-up approach, whereas a lot of other therapies that are more cognitive, like cognitive behavioral therapy or dialectical behavioral therapy, are considered a top-down approach. So EMDR can really work with people when they're feeling like they're in crisis. And so when they're in that kind of reptilian brain that's responsible for the most basic survival functions, EMDR kind of starts there. And oftentimes what happens with trauma is that it gets stuck in the limbic part of the brain. And so with the processing done in EMDR, our goal is to move that to the neocortex. The limbic brain wasn't designed or meant for long-term storage, but traumatic experiences can be stuck there. And so we want to move that to a different part of the brain, to the neocortex, where it is meant for long-term storage. And it's something that's not constantly jumping out at you. It's still there. You're not forgetting about it. It doesn't mean you don't care or anything like that. It just means it's not constantly jumping out at you. It's less charged. So EMDR therapy is made up of 8 phases. So I'm just going to briefly go over the different phases to give people an understanding of what this type of therapy looks like. So phase 1 is called history taking, and this is basically gathering history, listening for themes. We tend to gather more of a thematic history rather than a chronological history. And part of that, and I know this is another question that came up along the lines of memory loss. When someone goes through a traumatic experience, memory loss is very common. And that's part of the reason why we focus more on thematic history. Like, what are the themes that are coming up? Like guilt or feeling like you don't deserve good things, things like that. Like, what are the themes that keep coming up rather than, tell me the month that this happened and the year. And we don't need all of that. And a lot of people may not remember those things, may not remember all of it. They may have lost some of that. Thinking about what does the person want to get out of treatment? And learning about the nature of the loss, understanding the individual's relationship with the deceased loved one, and the impact that grief is having on their daily life, and then conceptualize how can EMDR be utilized? How can it be helpful? And then phase 2 is preparation. And this phase is another question that came up and comes up all the time, is how long does EMDR take? And there's not a black and white answer because it really depends. It depends how complex things are. And oftentimes, I would say the majority of the time, I see at least complex cases where there's a layers of stuff to kind of go through, and that may take longer. So there's not a set amount of time. And in this phase, we don't know exactly how long it'll take either. We're basically, giving education about how EMDR works and getting the client ready to experience the reprocessing part of it, which can be tough. Probably not as tough as what many of you have been through. However, it can bring up a lot of those icky feelings, and it can be hard. So we want to make sure that people have enough of what we call adaptive material, which is like helpful stuff, good stuff in their life, whether that be a combination of who are the supports in someone's life, what are some of the things they can do for self-care, and really emphasizing a holistic approach too. I think is really helpful, and you can really build on so many things that a client may already have that are positive. It often comes up, can I do EMDR on myself or a loved one? And I would say, for the most part, no. You want to have a trained EMDR therapist utilizing EMDR with you. However, I would like to offer all of you a very simple resource, we call it, a skill that you can use if you find it to be helpful. And with EMDR, a lot of it has to do with bilateral, like the back and forth sensation. So uh, we do that naturally a lot by just walking or like thinking about rocking a baby, drumming, bicycling, things like that. And so the butterfly hug is something, if people want to try it, you can connect your thumbs and put them up here, or you can just cross your arms, whatever feels comfortable, and do very slow taps like the wings of a butterfly, back and forth. And this can help be calming to your central nervous system. And if, say you're at a meeting and you're feeling anxious and you can't do this because it's too obvious, you could also slowly tap on your legs back and forth, or even tap your feet. Anything bilateral, but you want to go nice and slow. Okay, because going too fast is likely to make you more anxious. So if you do this and you're finding I'm feeling more anxious, you probably want to slow it down. You could also pair this with like a positive affirmation or something along the lines of, I can get through today. I can handle this. Okay, so just something that you can all take with you and try. And this is something that you could share with a loved one. And then once we decide that someone has enough preparation. Then we move into phase 3, which this phase is very quick. It's only about 10 minutes. And here we are essentially activating the client and bringing up the distressing material. So we ask certain questions to bring everything up with the client. And then from here, we move into phase 4, which is, again, what most people think of with EMDR, the eye movements, or people do fast tapping. This is when get fast. And here, sometimes I compare it to like a train ride, and it's kind of like you're on this train. Sometimes it feels like it's moving really fast and you're kind of watching scenery pass you by. Everyone processes in different ways too. So some people may have things come up around body sensations or thoughts, feelings, memories, or a combination. And you're going through this, and again, it's the point of this phase is to desensitize and make something less distressing. So, for example, if you're having an intrusive image that you just keep seeing over and over, and you're wondering, like, why does this keep coming up for me over and over? And it's like right in front of your face. With EMDR, the goal would be to move it away so it's in the background somewhere. Again, you're not erasing things. You're not, sometimes something comes up with EMDR and grief around people feeling guilty about bringing that distress down. And it doesn't mean that you're not going to, miss your loved one or anything like that. It's more about being able to kind of function and not having things so charged and jumping out at you so much. And so going back to, what's realistic and what's not with EMDR therapy. EMDR therapy likely won't make you miss your loved one less. I wish that it could help more with that. Um, and just to give an example of someone that I worked with, which I know is probably a lot different than situations that many of you are in, but someone that I had worked with EMDR had lost their father. And they had been the one to find their father when he died. And she had the intrusive image of finding him and couldn't go in that room in the house. Okay. And we did EMDR and focused on that image. And we were able to get that image to no longer jump out at her. And she was able to go back in that room and watch TV and, enjoy being in that room. But she still missed her dad a whole lot. Okay. So just to kind of give you an example of what's realistic and what's not. And then once we get that distress down, then we're moving to phase 5, which is installation. And this is where we're trying to bring up that positive cognition that I had brought up before. As an example, I can find ways to honor my loved one. Okay, I do deserve good things. And working to get that to feel completely true. And so that's the point of phase 5. Okay. And then phase 6 is the body scan. So oftentimes trauma can kind of get stuck in the body and can live in the body, so to speak. And so with phase 6, you're going through and assessing for what's still in the body. Okay, like maybe you may have noticed, I bet a lot of people on this webinar have noticed some what we call somatic symptoms. Like my stomach feels like it's in a knot all the time, or my shoulders feel heavy, my throat feels tight. Okay, we're working through any of those body sensations to get those to go down or hopefully to go away completely, to have what we call like a neutral or clear body scan. And then phase 7 is closure. This is pretty simple. It just basically that once we're done in each session doing this tough work, because again, it can be tough. It's not always a walk in the park. It's not always easy. That we are helping a client to kind of return to their baseline, maybe using a grounding scale or something that can help them get on with their day after. And then in phase 8, it's reevaluation. We're looking for, has the progress stuck? Okay, how can we set the person up for success in the future with something, that a challenge that may come up? And where do we go from here? So that's a brief overview. I know it's very brief, of the 8 phases of EMDR. And then some of the most common questions that I get asked are, again, how long will it take? And I always say that every person is different and the timing varies. The more layers and complexity, the more time it will take. I also tend to use the metaphor of like building a house, and that EMDR is kind of similar. And the first thing we want to do is build a solid foundation. Okay, so if, for example, if someone comes to me as an EMDR therapist and they already have a pretty solid foundation, so like maybe they have a really supportive family, they have some hobbies they enjoy. Maybe they have a dog that they really love and they do mindfulness. They have a lot going for them and they have a lot to be able to handle the tough stuff. And so that may go quicker. I may move faster with that client. Whereas if I have someone come to me who, I get both types of clients and everything in between, where they feel like they don't have anyone who gets it or no one who's a support to them. And they don't have anything that they enjoy. They can't think of anything that's like positive in their life. That takes more time. It's definitely not impossible, and we can definitely work with clients like that. It just will take longer. So those are things to kind of keep in mind when thinking about how long might this take. Also, we get the question of, I don't have PTSD, post-traumatic stress disorder, so why is EMDR being used? And one of my biggest gripes is that EMDR is that people often have the misconception that EMDR is just for trauma, and EMDR is not just for trauma. Like I said earlier, most people have some type of wounds that can be addressed using EMDR and getting to the root of the negative cognition, like I am to blame. And we also get the question a lot of why hasn't the therapist started EMDR yet? And so we just went over briefly the 8 phases of EMDR therapy. So EMDR is not just about the reprocessing, it's also that phase 1 and phase 2. That preparation is really important. So likely they have started EMDR, just not the reprocessing part yet. And then sometimes a therapist may target, and when I say target, I mean um, it's like what they're picking or what they're working on reprocessing. And sometimes you may say, well, this is the thing they need to target. This is a trauma, but they're targeting something different. Why is that? And oftentimes there may be a roadblock or a reason that something else may need to be targeted first. And we also don't always recommend going after like the worst thing or the most traumatic thing right away. So for example, if a client does have a belief, I can't show my emotions or I can't let it out, before we try to target something bigger, we need to work through that and go after that first to be able to help someone to be able to show their emotions, to let it out, because that's really important in doing that EMDR work is to be able to emote. Okay. And then how can I find an EMDR therapist? Okay, again, I would highly recommend EMDR. I know I'm biased, but I really do think that it can be incredibly powerful. And I get the question all the time of how can I find an EMDR therapist? Who should I go to? And so this is a link. And if you don't have this link or lose it, you can always Google like EMDR find a therapist. And on the EMDRIA website, which EMDRIA is EMDR International Association, there's a search engine that you can search for EMDR therapists, and you can search, by your zip code, by the type of insurance you have. One thing that I might recommend is checking off there's a filter to get an EMDR certified therapist. And that just kind of sets apart um, the people who have gone above and beyond and really done extra training and consultation and really are more of specialists in EMDR therapy. So that's something that you may want to consider as well if you're looking for an EMDR therapist. And it's also always important when looking for a therapist to find someone that you feel comfortable with. We need to listen to our body's kind of alarm systems. And so if you find that you connect with someone and you feel comfortable with them, that's really important. And if you don't, then you may want to evaluate, do I want to give this more of a chance or do I want to try to find someone else that I can connect with more? And then moving to questions and hopefully answers. I'm hoping that I can provide some more insight or input to some of the questions that all of you may have.
So we'll start with some of the questions that we got from registration, and then if anything else comes up, you guys can feel free to type it in the Q&A, and we'll try to get to those as well. So one of the questions that we got was, do the triggers ever stop?
Okay, so I'll answer these the best that I can. I think they can. So like I was saying, the point of EMDR, one of the ways I look at it is if something is really charged and like jumping or right in front of your face, hopefully we can move that further back and make it distant. So with the triggers, that's kind of similar. If there's something that is triggering you, very often, yes, we can target that. We can work on that to make that be less charged. And of course, it probably depends on, what it is and the circumstances. But overall, yes, triggers can get better, but they may need some help along with getting better.
For this next one, it's one that we got while you were doing the butterfly hug. If you could, can you stop sharing your screen for a second so everybody can
Yeah.
see better? Can you re-explain the butterfly hug?
Yeah, absolutely. So the butterfly hug, with EMDR therapy, again, the premise of it is doing bilateral. And so with the butterfly hug, you're doing, and again, you can connect your thumbs like this, like the wings of a butterfly, and tap back and forth nice and slow. Or you can just cross your arms and tap nice and slow. And this is something that kind of calms your central nervous system. And again, the importance of going slow is something I'd like you all to remember, that you don't want to be going fast for this. Okay, there's, going slow in EMDR for building resources and calming things, and then fast is more of the like reprocessing and going through the difficult stuff.
Um, how soon is too soon to start EMDR after trauma?
Yeah, so I'm going to answer that in two different ways. With trauma, for the most part, I would say the sooner the better. If you start sooner with trauma, oftentimes you can avoid, it getting worse or going into a full-blown PTSD diagnosis. However, I'm going to separate grief a bit from that. With grief, I do think there is, a natural process of grief that is important to allow to occur and to kind of be in that. And that may be a little bit different for every person, but I would at least give yourself, a couple of weeks, maybe a week. You could always jump into some of the preparation work, but to actually start the reprocessing work, you want to give yourself a little bit of time in that grief phase when a loved one first passes away.
And how common is memory loss for bereaved caregivers?
I would kind of lump this in with trauma and say that it does happen quite a bit. I think that oftentimes when something traumatic happens, we do tend to lose certain memories. Also, dissociation is something that comes up very often with trauma, and dissociation means to sever or to separate from the present moment. And it's kind of a defense mechanism that a lot of people use to get through really hard things, really difficult traumatic events, and something that we all do to some extent, some more than others. And I bet a lot of the people here have dissociated during certain times to physically be present, but mentally and emotionally kind of be somewhere else. And that can be another aspect of memory loss as well.
And then going off that, why do trauma flashbacks repeat so frequently with trauma?
Why do they? That one's kind of hard to answer without knowing more. But again, oftentimes something will kind of stick with us. And this is pretty common where, again, someone may have an intrusive image or a recurring nightmare or something like that. Something that, like, going back to what I was talking about in the brain, where it may get stuck in the limbic part of the brain, where there's also in that part of the brain, it's the same brain that like a dog or a cat have, that has no rational sense of time. So we may have something seeming like it's happening over and over again, even though it happened 6 months ago or 6 years ago, even. And so that can happen over and over. But the good news is that with EMDR treatment, we can bring those triggers down or bring those flashbacks down and have it not jumping out at you so often, or maybe not at all.
And so we got a couple asked live. Is it ever too late to use EMDR?
No, I don't believe so. I'm thinking about someone who came to me when they were in their 70s to work on the trauma of when they were born. So 70 years later. So I think there's always time, and many people wait years. I mean, if you can get it sooner, please do. Like, don't do that to yourself. Why keep suffering if you can get the help sooner? But I don't think it's ever too late.
Okay. And another question that was just asked, I know it's very specific to the individual, but in general, what are typical minimum slash maximum amounts of sessions needed for grief trauma?
Again, it's so individualized, and also depending on how long the sessions are. I mean, to give a very broad range, and please don't hold me to this because again, it's so individualized, but maybe a very minimum of like 4 sessions. And again, that would be really, really light work. And for someone who's really got a lot of adaptive, like helpful, supportive things in their life. And on the other end of the spectrum, it could be years. It could be someone, again, if someone has layers and layers and stuff and maybe connected to maybe all this stuff about when they were a child and things that have come up then, or oftentimes people get in EMDR therapy and then it's like, oh, this works so well, I want to go work on this now. I found that, I only do EMDR therapy in my practice, and I don't have clients as long as I did before I was doing EMDR therapy, meaning that most of the time they do eventually move on, someone lighter, maybe a few months, and someone with more stuff, maybe it's a year, maybe it's a couple of years. Let me share my screen again.
I think that is all the questions that we got for the Q&A. So if you guys don't have any questions, any other questions, I really want to thank Olivia for taking the time to share all her knowledge about EMDR. Um, it's a super important topic, and I hope that it's a resource that our bereaved families can take advantage of, and I hope it was informative for hospital partners as well. And I'd also like to thank you, our attendees, for your participation and thoughtful questions. The PBTF is here to help no matter where you are in your brain tumor journey. So please reach out to us for support if you guys need it. And we will be sending you a link to the recording of the webinar, as well as the slides from today's presentation. And we'll be sending you a survey as well. And there's the QR code for the same survey on your screen. So that is it for today's webinar. Thank you so much, and have a good rest of your morning or afternoon, depending where you are.